My name is Zanyolo Alan. I'm an occupational therapist representing Lotus Therapy Center. An occupational therapist is someone who has been trained medically to come and help someone achieve their independence. It involves about we giving you your skills, the skills that have been impaired until the time you can now successfully do every activity that you were doing before. That with autism there is a deficit in concentration, so an occupational therapy will come train the child until they achieve the particular concentration level and the threshold that they intend for classroom skills. Sensory integration involves how you interpret the sensation in the environment and how they are reflected back in the mind, in the brain for an action to be performed. For example, simple sensory like touch, the way we perceive it and how your brain will tell you this is really touch. We normally get in a way that someone has sensory issues or sensory insecurity in a way that when you touched, sometimes you overreact or underreact. For those who are overreacting, occupational therapy comes in through desensitizing. If you are underreacting, that means you need a lot of activation for that. Therefore, with the interventions that occupational therapists use, the likes of Wilbur protocol will come in and train you until you achieve the required tactile and other sensory threshold that you have to for you to be active in a particular environment. But all in all, we always use we say we modify. We'll cut the activity into the smallest that we can and use the locally available. But say if you lack the therapy ball, there is something home. You can use the jerry can. But say we want to train your child on standing. We won't really need standing aid, but while you have a stool, we can still maneuver around stool, modify it until we achieve our final goal, that is stand. With occupational therapy, its independence are not really the problem based. The goals are problem based. That once you achieve a certain goal, then the problem is done. But now with OT, we'll continue until you fully independent with the particular ADL that you're supposed to be doing. Activity of daily living, for example, bathing, that is under self-care, schooling, if you're going to school, eating, feeding, among others. Form a particular thing, you have to have control over the movement and the posture. So being unable to do that, now an OT comes into training on weight bearing and how you maneuver about controlling your posture and movement for you to perfect a certain activity of daily living for your independence.